We continue our discussion tonight on the epidemic of child and teen pregnancies in South Africa. In KwaZulu-Natal, the MEC for Health there urged parents to get more involved in their children's lives after the province recorded over 25,000 pregnancies in females between the ages of 10 and 19. The Northern Cape Education Department reported that 3,000 pupils got pregnant in 1 year, with the youngest being 10. Tonight, we're asking what steps schools should be taking. Coceka Nogoduka is the Department of Basic Education's Chief Director for Care and Support in Schools and joins us now. Good evening, and welcome to you, Coceka. What are your reactions to another set of disturbing numbers insofar as teen and child pregnancies are concerned?
Thank you very much, Imani. Good evening, and good evening to your viewers at home. As the Department of Basic Education, we are really concerned with the increasing numbers of teenage pregnancy in the country. Looking in the past 5 years, we've seen quite a huge increase in terms of numbers of children that are getting pregnant that are school going. And the of great concern is the increasing number of children that are getting pregnant between the ages of 10 and to 14. And as you are aware, according to the South African law, that is statutory rape. And the concern is that these numbers are increasing. So as a department, as we have the mandate to keep learners in school, especially the girl child, this is quite disturbing and concerning. And this is happening on the backdrop of the Department of Basic Education having launched the policy for prevention and management of learner pregnancy in schools.
Yeah, that's actually what I want to talk about and go directly to, because 2 years ago you were at that South African National AIDS Council meeting, 2 years ago expressing concern about the high rate of learner pregnancies, and this policy to reduce this was born. What has been the fruit of the prevention and management of learner pregnancy plan? You've just said the numbers are alarming. These cases continue to escalate in South Africa.
In terms of the prevention of pregnancy, this is work that we are doing with the Department of Health. But you would remember, Imani, according to the Integrated School Health Policy, which is the policy that allows the Department of Basic Education to provide contraceptives, test for HIV, as well as provide other health services in schools, it is clear that you need a parental consent for the child to be able to access those services. So in the past 2 years, during the COVID time, when we were also as a department providing and promoting COVID-19 vaccination, parents started pushing back and not allowing their children to access these health services in our schools. So that is one challenge that we have in terms of learners getting access to contraceptives, to condoms, and any other health services, including pregnancy testing within the schools. Therefore, the responsibility of ensuring that learners are then prevented from being pregnant solely relies on parents and learners accessing these services through the health services, just because parents are refusing to sign parental consent for the learners to access the services within the school premises. So that is one challenge, which is the biggest challenge that we have. But as the education sector, we continue to teach our children. As you are aware that we are implementing the comprehensive sexuality education program that gives information to learners around child abuse, sexual abuse, what are the signs, what are healthy relationships, but also start getting into the information around healthy and safe sexual contact. But as you are aware, Imani, these pregnancies, majority of them are a result of statutory rape. And the worse the concern is, most rapes or most pregnancies are a result of a rape, but not of a stranger, but within families, within communities, and with people that are known to our children. So that is the greatest concern that we have with these numbers that continue to increase.
Well, let's go to that concern, especially given that we have such limited time. When learners come to school and declare their pregnancies or it becomes known, what steps from a legal perspective must the school authority follow? And especially, as you say, in the case of 10-year-olds, between 10 and 14, statutory rape, what is the school obligated to do in terms of the families and the police?
The schools are supposed, according to the policy, to fill what we call Form 22. Form 22 is a form that is used to report child neglect and child abuse. and the school fills in this form with the information that they will get from the child. But in terms of the cause of the pregnancy and who impregnated the child, we try and make sure that that information is not solely texted by the educator, but the Form 22 and the child are then referred to a social worker. So the social worker will be invited to come to the school to be able to interview the child, get the information, fill the form further, and be able to take the case to the police. So with each pregnancy that happens in a school, a Form 22 is filled by an educator, and the educator will make sure that the child is linked to social development and linked to South African Police Service.
What is your awareness then of the follow-through? These forms are filled, the responsibility is then passed on to the caseworker, social worker, and the police, to continue with. Do you know, are you aware that there are charges eventually pressed, that there is a prosecution that happens? Because that too could serve as a deterrent to communities, as you say, a number of these crimes are potentially committed by members of the family or people known to the children and to the teenagers. Is it successful? Does something happen?
Imani, something does happen. The police will investigate the case. Again, one of the challenges that we have is still within our communities and within our parents, who then intervenes, withdraw the case, citing that it's a family matter. They will discuss this matter at home. And sometimes the police are even unable to identify the perpetrator because the communities will not divulge and assist with the investigation. So some of these cases don't go forward. The investigation continues, and after some time, you'll find that the police officers will then give up on the process. But as you are indicating, more work needs to be done. As the department, we need to have more collaboration and more working together with both the Department of Social Development as well as the Department of Police, but also Justice as well, to make sure that these cases are pushed forward and we can see results in terms of the perpetrators that impregnate our children.
Coceka Nogoduka is the Department of Basic Education's Chief Director of Care and Support in Schools. Thank you very much for your time tonight.